Good evening, everyone. I hope I am audible. Uh, I hope all of you are safe, staying at home. It's a difficult, unprecedented moment, or the place where we all should not be. But nevertheless, let us utilize this time to do something better and informative. So today I'll be talking on healthcare. So I'm very lucky to talk on this topic at this point of time because the crisis is all about the healthcare. So I'll be talking about healthcare, past, present, and future, how it was before and how it is now and how it will be in future. So myself, Dr. Mallikarjunaiah, basically I'm a clinical physiotherapist. I have a clinical experience of almost 15 years. I have worked in various hospitals and I have my own clinic and the centers in two places in Bangalore. I did my bachelor degree and master degrees from Rajiv Gandhi University of Health Sciences, and I did my PhD from NITI University from Bangalore. So today I'll be talking about what exactly the healthcare system is all about. Though you all know about healthcare, but how healthcare is framed or formed in terms of their hierarchy or the delivery of health is concerned. And the next one, the population overview, means it is very important to know us what exactly the population is, and accordingly the health sector should act upon. And next, the healthcare delivery in India, how it is delivered in India, and opportunity in healthcare sector, where are we looking at the opportunities, and the workforce in India. We all know that every time when we read a newspaper or the television for the news channel, they always say that there is a deficiency of healthcare workforce in India. So we will be discussing about that and deficiency report and what exactly is required, how much deficient we are, and what are the market drivers, what we can take from there, and the strength, weakness, opportunity, and threat analysis in the healthcare profession, and the future of the patient-doctor consultation. So tomorrow, what we are doing right now, so I'm talking at one place, you are listening at different places or different parts of the world. So tomorrow, we can see this as a patient-doctor consultation. So you never know how the world is changing. So I'll be talking on patient-doctor consultation. Then the transformation of the health industry post-COVID. So the post-COVID, we don't know when we call it as post-COVID. So what happens to healthcare industry after the pandemic and the career scope in healthcare? As Winston says that healthy citizens are the greatest asset any country can have, isn't it? So people say that the richest country is so and so. They are the well established, they have that, this. But nowadays, the people say that healthy citizens are the greatest asset than anything else. No GDP, nothing, no ratio, no percentage, all these things comes into mind at this present scenario. So health is a state subject as per Constitution of India. Today, I'll be talking about healthcare sector. So let me brief you about what exactly this healthcare sector, healthcare industry, healthcare market is all about. So health is the most important point in anybody's life. When we talk about health, it's all about the medical services, it's about the drug delivery, it's about the patient education, it's about the medical education, it's about the drug performance, it's about the drug control, it's about the medical tourism. When we go back to the history or go back to the preamble or the introduction of the healthcare, the art of the healthcare in India can be traced back nearly 3,500 years back. So when the human exists, from that time, we all will have the impairment or the ailments which tend to start. So when this starts, we always think about how to come out of that. So it means that the health is already started way back, way back. We can't even imagine when the humans have existed, the healthcare industry started. Early days of Indian history, the Ayurvedic tradition of medicine has been practiced. We know that we are the one of the leading healthcare practitioners way back, but not now, way back. So let me talk about that also in the coming slides. Healthcare is one of the largest, I would say that one of the largest sector in terms of revenue and employment is concerned. During 1990s, let us not go back, let me come back to 90s, that is 20 or 30 years back. Indian healthcare grew annually rate of 16%, which is very less. Today, the total value of sector roughly 9 to 12% of GDP. By 2022, India's healthcare sector is projected to grow more. This projection was done before COVID, but now we are talking at present situation. By 2022, India's healthcare sector will be the frontier in the world. That is the prediction, and according to the many news and evidences, because we are the leading frontier in terms of acting to the present situation. Let us go back to the history. Before independence, healthcare has been based on voluntary work. So you like to do some work, you like to do some charity, or you want to do one social service. You come forward, you find something, okay, something has happened, do massage, give some medication by the herbs or the plant, then it becomes a part of medicine or the traditional method medicine, what we call. But after independence, Government of India laid down a stress on a primary health care. It is the most important concept we should understand, the primary health care. See, most of us, a layman, let us say all of us are a layman, we never know or we don't know about the healthcare system. Primary healthcare, secondary healthcare, tertiary healthcare, private healthcare, hospitals. We don't know what exactly the hierarchy they follow in India. So we think that establishing a clinic and we can serve the society. No, it is not like that. The government of India has to come through a proper channel. So what are those channels? I'll be explaining in detail. I was talking about population and health sector. Considering the health sector, in health industry, the health workers are highest in number when it comes to some of the countries. But still we have deficiency of healthcare workers, not because the India is producing less number of health workers. It is just because there is increase in the population. Let me not talk about the population right now. I have one more slide which is very interesting. Most of you must be knowing by 2030, that is exactly from 10 years from now, we will be the leading highest population country when it comes, we will be overtaking by 2030. And just imagine what happens in 2050. That all prediction is there in the coming slides. Let us talk about population. According to 2019, it goes in a 10-digit number. Let me not read out. And the density means how many people can occupy in certain amount of space. That is 382 people per square kilometer. So growth rate is 1.1% by 2020. That is 20 by 2020 this year. Life expectancy, this is the most important thing, is 69.7 years. That is roughly around 70 years. So what we all should take away that so people can live up to 70 years. Means why we are not living like our ancestors, like why we are not living for 100 years, 80 years, 90 years. So life expectancy has come down, especially in males. They say that according to the evidence, the average is 68.4, that is 69, and females are more than men. And fertility rate, that is 2.35 children born per woman, that is very high. Very important thing which I want to point out here. I'm following a flow so that will bring a background story for what exactly is there in the future slides. That is, infant mortality is 29.94 deaths per 1,000 live births. Means every 1,000 live births, there are 30 people, 30 kids or the infants will be dying. So what is the cause? Why we have so lack of infrastructure or lack of medical personnel or lack of technology or lack of education? Where are we lacking? And come to the next view, that is age structure. 0 to 14 years in India, they are 28.6 percentage. That is 28.6 percentage of population belongs to 0 to 14 years. 63.6 percentage belongs to 15 to 64 years. 65 and above, that is very less. That is 7.8 percentage. So what we have to take a message here is almost more than 90%, to be precise, 92% of population belongs to age group which is belongs to 0 to 64. Means If somebody is into the health sector, there is a high demand tomorrow, especially in healthcare. This is what I was talking about, global expansion. So when we look about the global expansion, annual rise for previous 9 years, if you take China, India, United States, Indonesia, and Brazil, when we compare, so the rate, the percentage for 9 years, the growth annual rise is 1.2, that is in India, and the life expectancy is 69 years only. When it is compared with other countries, other part of the world, it is very less when it compares to other population in other countries. Next, this is what I was predicting. When we compare between China and India, by 2050, I already told that by 2030, we are crossing China, surpassing China. By 2050, we can't, they can't even compare with India in terms of population, which is very serious threat, as well as it's a high time that India has to have a better healthcare sector by coming years. When I talk about healthcare sector, healthcare delivery system in India, it is very vast. It is not a simple logic to understand how the hierarchy goes, like how it is at the state level. So here we should understand that India, having a 29 states and 7 territories, the states are largely independent in matter relating to delivery of healthcare. Each system developed its own system of healthcare delivery, independent of central government. The responsibility consists mainly of policy making, planning, guiding, assisting, evaluating, and coordinating the work of the state health ministry. Let us talk about more about state health ministry. So when we talk about more about state health ministry or the health system in India, it is broadly classified, or the hierarchy comes in this way: central, state, and the local or peripheral. We see one by one. The central level, what we call it as a main pillar of the healthcare sector or the official organ. The number one, that is the Ministry of Health and Family Welfare, the Directorate of General of Health Services, Central Council of Health and Family Welfare. So it is a board which controls the entire health system of India. How this function? Let us talk about Ministry of Health and Family Welfare. We all know that the structure. I'm not going to talk more about the structure. I have just placed to show you that what is the flow, what is how that standard operating procedures work among the healthcare professionals, which comes from top-down approach, way from cabinet minister to administrative staff. Next is the Directorate General of Health Services. It is again from the Directorate General of Health Services, Director General of Health Services, Additional General Director General of Health Services, Deputy General of Health Services, and then comes to the public or the social services. Central Council of Health, it is very simple. Union Health Minister, that is main chairperson, and the State Health Minister, that's the member. Coming to the state level, we all are aware about this. That is Ministry of Health and Family Welfare, State Health Ministry, and Deputy Ministry of Health and Family Welfare, followed by Health Secretary, Deputy Secretary, and administrative staff members. That's all about the broad body structure. So why I'm talking about that? Because India is a country where any policies which are made, any policies in terms of primary center, sub-center, community centers, it has to come through a proper channel. So there are a lot of manpower required, a lot of administration is required to monitor the entire healthcare industry. There are more than 720 districts. This is as per 2019 report is concerned. We have not got the exact report by 2020. Some districts in India, that is subdivision, talukas, community development blocks, municipalities, corporation, villages, and panchayats. So how they work? They work in a different sector, means different set of population are covered by different areas. So each are covered by different sectors and different administrative agents. So I was talking about health services in broad. If I want to talk, as I was talking about an umbrella term. So outpatient services, you all know that OPDs or clinics or institutions, wherever the healthcare system, this in broad sense, what they have to do at the time of crisis. There has to be a comprehensive treatment approach. There has to be accessible to the public and acceptable with whatever it comes. It is not that it should not be. It has to be like that. Provide scope of community participation and available at affordable cost by country and the community. So this is what I was talking about, healthcare systems intended to deliver healthcare services and represented by major sector different from each other, that is by the technology, which can be classified under 5 major sector. Number one, that is public health sector. When we talk about public health sector, again it is classified or which can be categorized or subdivided under primary healthcare, hospitals or health centers, health insurance schemes, and other agencies. So, and the next one, second one, private sector. We talk about private sector, that is private hospital, polyclinic, nursing home, and dispensaries. What I am talking is the present situation. We spoke about past. Now, what I am talking is entirely about the present situation of health sector, general practitioners and clinic, and the other system of medicine like Ayurveda, Unani, homeopathy, and unregistered practitioners, or what we call it as faithful healers and voluntary health agencies, which are coming up. What we can say it as NGOs, non-governmental organization. And the last one is national health programs. There are various national health programs which are formed depending upon the need, depending upon prospective status of the country, like eradication program, control programs, which are listed. I don't want to name. In short, when we look about the organization of health system in India, it has to go through a different channels like national level, state level, district level, and the block level. Whatever I said is about the governing council of the health sector, or I would say that stakeholders of the health sector. But still, under them, these are the functioning which are happening. So I don't want to name each because that itself becomes each regulatory bodies within that particular segments. Let us not go in detail about the services. Let us target where we are, where the health sector is all about, or the health sector is making lot of improvement in terms of country is concerned. The health industry, which is broadly classified as public sector and the private sector. So whatever I said, which most of the time which fall under public sector. Let us talk about private sector. We all know that only one we know, that is for profit, because most of us would have come across different health ailments which we would have gone to the hospital, we would have seen how the expenses will be. So we always think about one thing, that's a profit. There are non-profit organizations which works with different funds. They are called as charitable trust or dispensaries, and the hospital, which are most of the time it is religious or sometimes it is not non-religious, non-governmental organization which run clinics and to an outreach, what we call it as mobile units, which is the most important, which is trending. Okay, this is all about the system what we have. This is all about how we are supposed to go. This is all about, that is a hierarchy. Let us get inside the system. Who are all there? That is health workforce in India. So when we talk about health workforce, that is who are all comes under health workers. They are listed here. They are allopathic doctors, Ayurvedic doctors, homeopathic doctors, and so on and so forth. The list goes on. But here, very important thing which we are supposed to concentrate is the number, because in today's world or the present situation is all about the numbers. When we look at the population, what we have seen, because I didn't want to tell the population, that's why I was shown the picture of the population, what we have and what we have as a health professional. It cannot be compared with the available resources. As I said, the cost may not be, India is not producing the enough medical professional. No, India is sufficient enough to produce. The population is vast. It is getting bigger and bigger day by day. So the health workers, when we look about the numbers, it is very less. So it may come around if I want to name anyone, the allopathic doctors, which may come around 6,32,000 only. We talk about healthcare workers. Healthcare workers means who are qualified. See, qualification matters a lot when it comes to healthcare professions. Definitely, in any profession is concerned, the profession always matters. But especially in terms of healthcare is concerned, where they will be playing with the life of the patients, the health sector plays very important. In terms of healthcare professionals, we saw that so many professionals are there in the healthcare, but how many are with a graduate degree? How many are with a postdoctoral degree? Or how many are with postgraduate degree? How many are specialized? So that is most important because we are going into a super specialty now. Forget about specialty. So considering that, that's most important where we have to think upon where we fall short of the present situation. Let us go to a very important sector here. If you can concentrate on the graph with the health workers, with we can see on the top with postgraduate degrees, allopathic doctor. Let us talk about allopathic doctor now. Then we'll go to other healthcare professional. That is only 18.2% of the allopathic doctors are postdoctoral degree. And coming to Ayurvedic doctors are very less. Homeopathic doctor are very less. And Unani and dental are, it is comparatively less. Coming to the nurses, it is the most required profession or the healthcare profession. When you see the green, that is with secondary schooling, it is very high number. Means the qualified nurses or a qualified registered nurses are very less, and the qualified allopathic doctors are very less, and other healthcare professionals are very less. So it means that there is a high chance of or there is a high career scope which we think about the healthcare professions, and that is about the workforce. If there is, if we provide a proper workforce, where they will work. So we look upon the number of sub-center PHCs and CHC functioning in India. When we talk about the statistics, way back in 1995, the sub-centers and primary health centers, community health center numbers, when we look upon by 2019, so that is when we look about almost around 25 years, it is by next 5 years, it is almost a double the what we have with all the centers. So very important thing we should consider. The population is there, workforce is there, and we have centers also. Now let us distribute one doctor to particular population. If we look about the population, that is physician, let us take only the physician. It is the most required person in the healthcare professional as a doctor is concerned. As the first point of contact to the patient are physicians. They are 7 per 1,000 population. Means if we look only in India, that is only 7. I'm sorry. Just a minute. I'm extremely sorry. Just 1 minute. Yes, I got it. I go back to this. Okay. When we go back to the workforce, that is 7 physician will look after the 1,000 patients. It is very difficult to consider that when it comes to healthcare profession is concerned. So especially in India, I am talking about in India. So where in India we have a shortage? Where is the shortage? I would say best and the worst. So Tamil Nadu, people per doctor is 253. 253 patients seen by one doctor. Delhi, Karnataka, Kerala, Goa, and Punjab. They are the best. Coming to the worst, Jharkhand, Haryana, Chhattisgarh, UP, Bihar, and Himachal Pradesh. So the South India are producing enough number of doctors compared to other part of the India. So the healthcare profession is more in South India than in other part of India. So where we should look upon, considering the workforce, considering the health carrier, or considering the centers which are there. So where is the market drivers? What I call it as key opportunity segments. That is at the hospital services. Wherever anything you take from the hospital services, way from the reception to the highly qualified post-speciality doctors or medical tourism. Medical tourism, one of the biggest revenue for in India. But when I talk about post-COVID, definitely there is a decline for a short term. I'll be talking on that in the coming slide. And pathology services, that we call it as a diagnostic and medical device that manufacturers, and telemedicine, which is the most trending, which shortly I'll be showing some of the videos where we are going ahead in telemedicine. And health insurance. Health insurance is the biggest market, the chain of market, where especially in health sector, where everyone are supposed to have it in terms of better tomorrow. I was talking about private sector. Why this private sector is required when central or the government is doing everything? The earlier government on its own would not be able to provide the more facilities for the healthcare. You know that present situation, the entry of private sector to reduce the gap between the supply and demand, because there is always a space or the line drawn between different people. They always look about the comfort, luxury, requirement, and necessity. Sometimes it may not be a necessity, sometimes it may not be even to a requirement, sometimes it becomes a luxury in terms of wards or the treatment is concerned. That's why the the private hospital which came into existence. Because when we look about what is the difference, why the people are more into the private hospital than a public hospital. Public hospital funded by government, service oriented, do not much promotion by the government, charges low fees, lacks good infrastructure, process of admission is very difficult, no proper care of the patient people. While in private, doctors are highly qualified because they are paid more, profit oriented, huge promotions, infrastructure is well maintained, comparatively easy process, very good care of the patients. So where the government should look upon? So we should look upon the where recruiting the highly qualified and doing the best where the private sector is doing. Growth of population and the economy. Considering the population and the economy, the health sector, I would say one driver of growth in health sector is India's booming population. Currently 1.3 billion and increasing at 2% annual rate. By 2030, which I already said, India is expected to surpass China as the world's most populous nation. And also the rise of disease. Disease also is not behind when it comes to growth as or in terms of multiplication or addition of the disease or the ailment is concerned. While the ailments such as poliomyelitis, leprosy, neonatal tetanus, while soon being eliminated, but some communicable disease once thought to be under control, such as dengue fever, viral hepatitis, tuberculosis, malaria, and pneumonia have returned in force or have developed a stubborn resistance to the drug. Even now, the corona, the so-called COVID-19, has come into the picture. The Indian pharmaceutical market is one of the fastest growing market in the world. Sale increased by 27% to $12.3 billion in 2019. Many factors, including a strong economy and a country's growing healthcare needs, have contributed to this accelerated growth. Why I'm talking about this? Because these are all drivers of the better tomorrow. That is market drivers of the healthcare. That is a rising health awareness. Before there was no awareness. Now people are coming to the park. The people are on road. When people were busy in their schedule, they were always concerned about their lifestyle. Now, when we compare with 15 years before and now, the health awareness has increased so much. Even when patient comes to my clinic, they say that, sir, I have so and so clinical features, and I have done so and so investigations. I have done this blood test, I have done this X-ray. Please do evaluate for further treatment. And I have already taken first line of treatment, what we call it as conservative. Yes or no? Because if somebody gets fever, what we will do? We'll take one paracetamol and we'll see whether it subsides or not. If not, we ourselves will go to the, let us not consider myself as a doctor at this particular time. And I'll consider that I'll go to a diagnostic center. I'll get evaluated for all basic CBC, that is complete blood count. And if there is a variation, then I'll take a photo and I'll circulate, or I will send it to known people first. Then if everything doesn't work, then only we'll go to the doctor. So where are we standing? So healthcare is growing fast. That is increasing government expenditure on healthcare sector. The health insurance sector is also on the rise. So very important, when this lockdown was announced, very important thing which I wanted to state here, there was a statement which is given by most of the ministry, says that elective surgeries has to be avoided. What do you mean by an elective surgery? So you think that I don't want this, I want that. So you have a right to do that. So it has become an open platform market where you decide what you want, what you don't want. Means I want to look fair. So let me go for a cosmetic surgery. I want to get it replaced by elbow joint, knee joint, that is TKR, total knee replacement. I want to get hip replaced. So I will choose when I want. So definitely the doctor would have given pre-indication for that, but you will choose when you want to go for it. So it is that necessity and the luxury. The point of comfort is always a matter. So health insurance comes into the picture. Anyhow, I have an insurance, let me go for a surgery. So that is the most important thing. Insurance provides the luxury of getting operated. And then the private sector companies are growing fast in terms of owning and managing the hospitals. Very important, growth in the medical tourism, which is expected to grow high, which was growing high, but presently we all know that there is no transportation, which has come down drastically to almost 0%. Cost-effective surgical services, we all know that as the private sector increases, there is a competition for surgeries. According to the report, the cost of surgery in India is just 10% of that in US. US it is more. Why? Because again, for the insurance, there is a gradual change in healthcare sector with respect to technology is concerned. So government, considering all this medical tourism and the growing budget or the revenue in private sector, they initiated the union budget under finance minister in 2019 to spend 8.35 billion on healthcare, which is government of India has allowed 100% FDI. It's a huge investment. It's a huge investment in R&D research and a constant focus by government medical tourism by 2025. So India will become a big hub for medical tourism and healthcare BPO. We can't even imagine where the business is. So that is about healthcare BPO. Health insurance is availed by just 100 or 100 million Indians. Where are the other Indians? What are they doing? Definitely they will come forward post-COVID. So these are the partners, or these are the areas where post-COVID there will be a lot of changes, especially the payers. They consider the health as important part in their life. Pharmacy, doctors, own clinics, hospital, diagnostics, very important sector. Coming to the most important future of healthcare is concerned, that is future of patient-doctor consultation, is doctors will be saying that work from home. So nowadays the IT profession or the technical person used to say that we used to work from home today, or we have an option of work from home today. So that is slowly coming into the healthcare professional, what we call it as telemedicine, and robotic surgery is concerned. As we all know that most of the common man know the technical field. When in the previous days, maybe when we go back to 15-20 years back, 100 people used to do a work. For example, let us say 100 people used to do a work of so and so productivity. Now same 100 people can make, I mean, the 50% or less than 50% of people can do the same productivity because of technology. So even in healthcare system, the technology will overtake the workforce of the medical professionals by introducing the robotics. Most of you would have seen one video which has been circulated recently in 2 or 3 days back about the evaluation and assessment of a patient, corona patient or the COVID patient through a robot, which through the Fortis Hospital, Bangalore. So anyhow, I'll be playing one video about where are we at present.
Times of lockdown, Indians are turning to telemedicine, where they can access medical advice online, a move that is helping fight the coronavirus spread. So what is the telemedicine really all about? We're talking about. Take a look at this report by Pooja Shali. Go to hospital but need medical advice? Do not worry. Telemedicine is the new emerging option available to all those restricted indoors because of the lockdown. Medical help by registered practitioners is now within reach, thanks to information and communication technology.
Me and my sons have already used this and already consulted our doctors through phone, and it is really a welcome step.
So how do you use a telemedicine app? All you need to do is download the app on phones or log in to the website. Book an appointment with the concerned consultant and pay the fee online in advance. So doctor, I feel a bit of feverish, some cough symptoms. Do I have to go to the hospital? What can I do? Can you advise something to me? A consultant on the chat window listens to the symptoms and provides an advice. Sometimes we also mention the possible medicines. Okay?
We are supporting digital triage, doctors are screening patients and finding out which patients need further investigation, which are at hand. Second important work is that whatever necessary medical support is needed, that should be available to non-COVID patients.
Fresh guidelines to allow the use of telemedicine. Importantly, the prescriptions given through telemedicine is valid for over-the-counter drugs. With Ramkinkar Singh, Pooja Shali for India Today. Hello everyone, this is Rahul Kamal here. Hope you enjoy.
This is about the telemedicine. I'll just play one of the video, which is they have used about robotics.
Hi, name please. Sharat Kumar. Phone number please. 9030-300-300. Let me check your body temperature. Please take a step back and look into the camera. Your current body temperature is 100.8 degrees Fahrenheit. Do you have a fever, cough, throat pain or difficulty in breathing?
Yes, I'm feeling feverish.
The screening is complete. Now you will need to go to flu clinic for further assistance.
Hi, Sharon. I see that you have fever with high temperature. Let me connect you to the doctor.
How are you today? I'm feeling feverish, doctor. Do you have any throat pain or breathlessness? No, doctor. It looks to be normal fever and not COVID. Mitri will issue the entry pass for you. Thank you.
Please collect your pass and proceed through gate number 2.
Good morning.
Hello?
I'm good. Can you hear me?
We can.
This is Bella's first telemedicine appointment from her family doctor's office in Lexington, close to home.
This is for the lower minutes to operate around the
Dr. Andre Mullinaire is a pediatric pulmonologist.
This is the video which I am talking about. This is an advanced part of telemedicine or telerehabilitation, which we can expect in India shortly because the research is already on. You can see in the video.
Brilliant Children's in Roanoke. As a micro-preemie born at just 1 pound, Laura has been our patient since birth and sees several specialists.
the cardiologist, gastroenterologist, child development specialist, and pulmonologist.
Today's checkup is for her asthma.
The nurse will be driving the cart for you. and I will conduct a visit as if Bella were sitting in front of me.
Dr. Mullinaire is able to listen to her lungs,
Perfect.
her heart, and basically do everything he would normally do during an exam in person.
Are you waking up at night having to use your inhaler or needing your inhaler?
No, sir. She's still on oxygen.
The same quality care without the hassle of travel.
Just using the technology and seeing how he could see and hear everything like he was right in the room.
Bella sums it up best.
Yes, I thought it was going to be a little bit harder, but actually it turned out to be really easy. He could hear everything, he was a therapist, but like, he was actually there.
Provides service to patients who are more remotely located so they have better access to care. Thank you very much. All right, bye-bye.
Bye.
I hope all of you can see the screen. That is about the technology. That is about the telemedicine which we are talking about. Telemedicine is set to revolutionize the healthcare system. It is a delivery of healthcare information across the distance using telecom or online technology. Video conferencing between the patient at remote and the hospital with the specialist is the new trending which will conquer the healthcare industry. 90% of the patients do not require surgery, so the doctor generally need not to touch the patient, need not to be at the same place, so the patient can be treated from the different location. So this is the most important revolutionary which we can think about. This data is not from the Indian point, I mean from India, it is from other country, which says that artificial intelligence, the big data analytics, Health and other companies which works on health industries will be on high demand tomorrow when it comes to the different sector is concerned. What if there is a growth in healthcare? What if there is a huge amount of money being invested? So if there is a huge amount of money being invested or more amount of activity or technology being invested in healthcare, most of the areas will grow, like schools, neighborhood organization, civic group, non-profit organization, community center, mental health, faith institutions, law enforcement, drug treatment, employees, you name anything, everything will be organized. It is all about hitting a point to get the proper results. So it's all about advantage India because of the strong demand, because of attractive opportunity and the rising manpower in terms of medicine is concerned, in terms of healthcare is concerned, and also the policy which has been supported. This is a very important, the old data which has been taken from 2017 because I didn't get a data of 2019, maybe I didn't search properly. It says that the health insurance coverage to people in India, in rural and urban, when it compared, 82% or more than 80% of the people have not gone for the insurance is concerned. And coming to the future or thinking about the next assessment year, the financial year, the hospital and healthcare sector stocks were in focus after our finance minister announced the central plans to expand government flagship health insurance scheme. You all know that Ayushman Bharat Pradhan Mantri Jana Arogya Yojana, which is the most important scheme which is intended towards healthcare sector, but it is narrowed to a particular area or the particular health sector is concerned. So the India is looking at broadening the scheme in terms of health insurance is concerned. And also the finance minister announced the allocation of 69,000 crores for healthcare sector in 2021 union budget and slightly more compared to the last year. Of this, around 6,400 crores would be goes to the scheme which I mentioned before. Okay, what happens post-COVID? Why I have put this slide? Maybe this slide is not clear because I wanted all the data to be in one slide. That's why it is not clear. Why I especially got this image here, because pandemic what we are facing, it is not new to India. Definitely it is new to India or other countries in terms of name, in terms of the clinical findings, or in terms of how it is affecting to the world. But when we go back way from 1347, we have so many viruses or the event which have a spotlight made into limelight in the world, that is Black Death, smallpox, cholera, flu, Asian flu, Hong Kong flu, HIV, SARS, swine flu, MERS, Ebola, Zika, so many viruses which came and gone, we have come across. I personally believe that it is one type of virus where we have to just roll it over. So what transformation we expect post-COVID? Number one, fast tracking of implementation of targets means the healthcare sector till today they were very slow. They were very slow in terms of steps taken to better in healthcare sector. Definitely that will be fast enough. That is what we call it a fast tracking of implementation of targets for public health emergency within national disaster management plan. Community awareness towards hygiene will have positive impact in long term. Definitely we all have these kind of words exchange. Of course, end of the day it's India, so the India definitely will change in terms of a view what we plan for, that is Swachh Bharat definitely will have an impact on this situation, though in short term likely to increase PHC burden, because PHC is always a concern in terms of cleanliness. Third changes which can happen is gaps in care of the patients of other ailments. You all know that most of the hospitals have become COVID hospitals now, and most of the hospitals or the community centers are closed just because they suspect that COVID patients may get into the hospital. Means most of the businesses in the hospitals are also less. It doesn't mean that patients are less. Patients are humans. Definitely their patients are there, but patients are not going to the hospital. If any patient is not going to the hospital, it means that the patient would have had an acute disease. By end of COVID, it would have become subacute or a chronic disease, which can result in more fatal concern, which becomes a long-term burden for healthcare future. Means these ailments which are not harmful at this stage may be fatal later. So the healthcare will have a long burden when it comes to later stage, that is a post-COVID. Next, strengthening of government infrastructure and public-private partnership over next few years. There was a news that is only a news. We don't have an evidence. Says that government is planning to strengthen the medical or health sector. Hopefully, we keep finger crossed that will happen in India. But in near term, ongoing plans we'll see. But it may not be an immediate. But definitely, whatever the plans which are already planned will be executed. We'll see a realignment to that. Next, fifth, internalization of pharma supply chain and make in India focus for medical equipment. So pharmacies or the pharmaceutical companies will be on high demand on concept and also on the medical equipments which we tend to export or import from. So all these things which may be avoided because make in India concept can overtake all these things. Medical tourism will continue to see downtrend now because at least for the short term, maybe later. Increased use of technology, telemedicine, training of primary health workers and mobility hospital can happen. This is the most important aspects which will definitely will have a great hit, that is on the healthcare opportunities. Many of the people will explore which are the healthcare options which are available. So when we talk about healthcare, we think about healthcare or post 12th, we think about many options like technical, non-technical or the medical. Now the concentration is all on medical. Let us take a data of 10 years or the 5 years or 15 years back data. The most of the technical education is concerned, there will be always one or two colleges or more than 3 colleges will be having 1 or 2 seats left out which is not filled. But when you take a data in medical or healthcare sector, very now less limited number of seats which we say that which is not filled out, or it is excess, or there is a high demand. So what are those fields? Let us concentrate on some of the fields in medical courses concerned. So we have allopathy, MBBS, BUMS, BHMS, BAMS, Ayurveda, Siddha, naturopathy, dental, veterinary, BPT, physiotherapy. These are all falls under medical courses. Next, what are the other courses which are available? We call it as allied health sciences, allied health courses. B Pharma, BSc nursing, occupational therapy, anesthesia, cardiac care, clinical optometry, imaging, medical lab. nuclear medicine, operation theater, perfusion, physician assistant, radiotherapy, renal dialysis, so on. The list goes on. This is only a few. There are many courses which are available under Rajiv Gandhi University of Health Sciences, where we work on, and many other paramedical courses even do exist. So considering all these things, considering the population, considering the infrastructure, considering the centers, considering the opportunities, let us see what are SWOTs, strength of healthcare sector, because it's a low cost of production, specialization infrastructure, specialization for efficient technologies, large pool of skilled doctors are available, and low pricing in public hospital, that is for the competition. What are the opportunities? It is largely untapped market, switching over from the process like patient to product patent, that patent to product patent, growing incomes, and growing attention for health global outsourcing hub for pharmaceutical products. And what are the weakness, let us say weakness, or the things we should be careful? That is highly fragmented leading price competition which is existing. So definitely their weakness in terms of stakeholder is concerned, but profit in terms of common man is concerned. Treatment is not affordable, but it may not be affordable. When I say it is not affordable only in few areas, but in many places it becomes more easy in terms of finance is concerned. The threats of course is not from within India, it is outside India where they start manufacturing the low cost devices. With this all outset about what is the population and what is the outstructure and all about the health, considering everything as a health, I would say that health is wealth. Healthy citizens are the greatest asset. According to one of the famous personality of Mahatma Gandhi, it says that it is a health that is real wealth, not a piece of gold and silver. To conclude, thank you. Stay home, stay safe, flatten the curve. Thank you. Okay, I will take some questions. I will hope all of you got some information on about the healthcare and future of healthcare. Okay, today most of the general practitioners are not practicing owing to COVID. Can online replace the face-to-face visit? What will be the missed in your opinion? How will one compensate? Very good question. General practitioners. See, as far as general practitioners are concerned, telemedicine is just evolving. See, any patients, let us take a practical scenario. Somebody calls me and says that, sir, I am having a chest pain and I'm getting a severe chest pain. I'm not able to walk, not able to move. So if the general practitioner prescribes any drug online that is subject to clinical examination or on-hands examination only, we cannot completely replace the existing mode of patient consultation. That is number one. Number two, general practitioner not practicing just to not to become a source of infection. Many of the clinics are closed. Many, not there are few clinics are open. Many clinics are closed just because they doesn't have protective equipments. What is called as PPE, personal protective equipments, are not available. They don't have aseptic precautions in the clinic. Hence, they have closed. But definitely, as we all I'll give an example of two scenarios. When we all were in campus, I'm talking in terms of teaching methodologies concerned. When we have students in front, we used to talk and say that, oh, this is how the interaction will go on. But now we have shifted to online teaching. But when we were there in the colleges or in the classroom, we always say that online teaching has so many disadvantages because we can't see the children, we can't see the students, we can't assess the students. There are so many pitfalls or demerits we can name or list out. Likewise, but we are getting adapted to that technology now. Likewise, there are a lot of disadvantages faced or will be facing in terms of telemedicine is concerned now. Maybe the future it is a requirement. I hope I have answered your question. Okay. Recently, I experienced a miss of IV injection for elderly, a miss of elderly though known and unknowingly prescribed. How does this will help in future? Will there be two agencies, one prescribing and second administering? Okay, I have one more video. If you allow me, I can show one more video, and we are happy that it happened to be in India. I'll just show you. I have one more video for this.
In this eye clinic in Undipati village in Tamil Nadu state, patients are seeing things a little differently. Raja
I hope all of you
Manikam
can see the video.
complains about an eye injury, and 15 kilometers away, an ophthalmologist at the Aravind Eye Hospital in the city of Teni diagnoses and treats him. Both are connected through an inexpensive Wi-Fi video conferencing network. It is called telemedicine, and it is increasing access to care in a country that is home to the world's largest number of blind people. 8 vision centers have opened over the past 6 years in Teni district. The centers are run by an ophthalmic assistant who is trained to conduct a full eye examination, administer diagnostic tests, treat simple ailments, and prescribe glasses. A doctor at centers as far as 150 kilometers away gives the final word to villagers.
It is a useful instrument for the villagers. We can actually talk to the doctor directly from here.
Raja Manikam normally would spend a full day traveling to the Aravind Eye Hospital. Instead, he traveled only 3 kilometers by local bus to this vision center in his village. His exam cost about 50 cents, half what it would cost at the hospital. He saved $2 on transportation, which he says he can now use for medicines. The assistant also found a cataract in Raji Manikam's eye, which will require surgery at the hospital. Doctors say this early detection has prevented Raji Manikam from becoming blind. Under the World Health Organization 2020 initiative, India has pledged to eliminate avoidable blindness in 10 years. The WHO reports that about a third of the world's 45 million blind people live in India, and the majority of causes, such as cataracts and diabetes, are treatable. Aravind Eye Hospital has conducted mobile eye camps in villages across Tamil Nadu over the past 2 decades. Eye doctors have administered day-long screenings.
So what we have seen in the video is, now we look about, as you rightly said, what we are seeing, consultation at one end and treatment at the other end. Yes, it is possible, but the thing is, the scenario where right now, if a doctor or a general practitioner can see, for example, 10 patients in a day, so if it becomes kind of telemedicine, he can treat more number of patients. Definitely in terms of delivery of a drug or the injection, what you rightly pointed, it may go to a different extent because the other health professionals are more in number when it comes to specialty is concerned. Yes. Next question I'll take. When we look at the death rates, we see COVID death rate at 1000 plus. What could be the death rate of those with other condition which used to be the case pre-COVID days, comparing it previous years? Okay, very good question. I think yesterday we had one presentation, the COVID enigma by Dr. Manish Paul. So he clearly pointed out that every when we talk about the death toll, other than COVID, it is roughly around 1000 per day. Now it has increased up to or roughly around 80 or 90 in terms of COVID patient is concerned. May not be a much when it comes to non-COVID, but definitely it will be more. I'm talking only in terms of in India, but when it comes to other part of the world, definitely it is higher than the regular death toll. Okay. As we all know, the economy of the country has reduced to a good extent. Will the employment increase in healthcare industry? Will the government private hospital be able to give a good salary to the employee? Very good question in terms of manpower, human forces. See, when when the healthcare industries think about better infrastructure, better healthcare, the delivery of the healthcare can be given by a better healthcare personnel only. Definitely, they should consider, if you ask me, they should consider giving a good opportunity to a well qualified doctor and increasing the healthcare sector, increasing the health delivery to the next level, so that the Indian economy can be compared with any other countries. We noticed that attendance of acute cases that used to be lined up pre-COVID days have almost disappeared. As a clinician, can you please throw some light on if we need to change the way we respond to symptoms? Absolutely, absolutely right. So rightly pointed, very nice question. There is a number of cases which is reported at OPDs or at the private clinics has drastically reduced. I'll just give an example. Say for example, 10 days back, my neighbor got some symptoms, flu symptoms. He called me and he said that, sir, I'm getting panicked. I got a flu. I have a chest congestion. I said that it is not, may not be a directly, we cannot diagnose it as a COVID. So he get panicked. Then I told that you wait for some more days. So he started, he was like, 2 days he will be fine. So I said 2 days he will be fine. Then he waited for 2 days, and the third day he is absolutely fine. So they get panicked. So likewise, the symptom, why I'm giving an example this is, if before COVID, if we have small symptom, if we have some chest pain, if we have some headache, immediately we go rush to the clinic. Immediately we go to the centers, and what we do, we get diagnosed. Sometimes we say that doctors, we will tell doctors that please go ahead with investigations like CT scan, MRI, X-ray, and etc., which is not at all advisable. So we should know where we are supposed to go and get tested, which most of the common people lack. And I'm not telling that you should hold on to your symptoms, but you should judge yourself that what is really causing a trouble, what it is, if not, should avoid. If in case, if you avoid that, then you can avoid any other symptoms also. Because now what is the present situation is, if somebody is having any other symptoms like leg pain, back pain or something, they feel scared to go to a clinic just because they may get infected. So then they try to bring all traditional technique and they get it cured by themselves. They are not coming. So definitely, as you rightly pointed out, we have to change ourselves to where we respond to the symptoms. Will there be any changes in MBBS placement post-COVID situation? Um, if you ask me, definitely yes, in terms of workforce is concerned, because as per Rajiv Gandhi University, they are not looking at the degree what you have right now, because the situation demands the healthcare professionals where they can be trained to see the changes or the crisis. And coming to the MBBS placement is concerned, definitely there will be a high demand. Definitely there will be high demand, very high demand in terms of healthcare sector in future. The use of microphone in video you are showing looks too risky in these COVID days. Maybe they should have disposable covering over that. Good observation, I would say. Good observation. Nowadays, all are into the situation where they see a lot of things in the social media. A lot of precautions are taken. Definitely, that video is very old video where in Tamil Nadu they started to entering the rural health. That is a program which they have started with rural health, where a doctor will be sitting in a remote place or a district place. He will be assessing the condition. Definitely, when it comes to a COVID patient, aseptic precautions has to be taken in terms of giving them any investigations or treatment is concerned. Telemedicine is indeed a good concept, but the issue is how practical it is in a country like India. That's the most important question. There has been many clinical trials has already started. There are something called FDA approved softwares. I didn't mention much about telemedicine. There are FDA approved softwares which are designed or intended to test the sensitivity of the condition or the reliability of the equipment, and then the telemedicine can be a great hit. unless that we have only a video call, what we call it as a telemedicine. There will be a next level of telemedicine, which will be of more success than what we call it as telemedicine only through video concept. The statistics which were shown in the presentation does not include medical profession of physiotherapy. So how that related to the current situation? See, very rightly pointed that doesn't not include medical profession of physiotherapy. Means the physiotherapist is definitely of great help. You may not be aware about the fact that the COVID patients, there is a high, the target organs infected is the lungs. So when it comes to the lungs, they always have that something called, it's the most important organs for breathing. You all know the common, if I want to say in a common man, the most important organs in the body for breathing is the lungs. The lungs are affected by a physiotherapist. I would say there is a specialty in master degree called as cardiorespiratory physiotherapy, which they deal only the cardiorespiratory patient and general physiotherapy. So where the physiotherapist will be teaching some breathing exercises to overcome breathing difficulties. So at this point of time, these COVID patients can be managed by a physiotherapist at the different sectors at ICU, that is intensive care unit, where they can remove secretion and they can give a better breathing exercises, and they can bring back the lung volumes, thereby which helps to overcome the breathing difficulties. Definitely a physiotherapist will be of a great help when it comes to a situation in terms of COVID-19. Okay. When patient get discharged, are they getting enough information about the use of medicine or any other medical apparatus? Don't you feel the role of paramedical personnel play more role in giving advice to discharge patient? Definitely. Most of you are attending would have had a own car. Yes or no? You all must be having your own car. But the car is delivered to you, you will be giving, they will be giving a user manual. Yes or no? Likewise, even for example, we give a spirometric, that is a breathing technique unit. So practically the health professional will demonstrate, will teach, then the patient will be discharged. Patient before discharge, there will be some checklist that whether the patient information is given, the exercise charts are given, whether a demonstration is given. Likewise, there will be a checklist for each of the hospitals, especially in COVID patients also. Without going to that routine checklist, patient will not be discharged. Definitely a sound advice on each of the do's and don'ts has to be given to the patient after discharge, before discharge to the patients. When patient gets, okay. Okay, I hope I made a justice to the topic which I have chosen. Anything more about this, you can send it to the below mentioned, or you all will be receiving an email. If you have any queries regarding this, you can write a mail in detail. Last, I would say that thank you all for listening to me on healthcare past, present, and future. Stay home, stay safe, and flatten the curve. Thank you. Okay, I have one more question added up. How does the post-COVID healthcare systems look like? Definitely different. Definitely different in terms of handling is concerned. In somewhere in my presentation, I mentioned that a role of a healthcare, that is assessment, diagnosis, delivery. So definitely post-COVID, the assessment of the patient is entirely different. It becomes a new assessment protocol in terms of assessment is concerned, and definitely diagnostic protocol is concerned, and also delivery of treatment. Definitely a huge amount of change which can bring up a huge amount of change in the terms of better identification of the diseases. It is good for healthcare system and the population. What's your take on prone positioning improving oxygen exchange in the COVID patient? Wow, very good. See, this I think very particular in terms of, you would have heard about many evidences which says that prone position will improve the better performance. Definitely, the prone position tends to increase the lung volume, thereby giving the better breathing movements. Definitely, it is difficult in ICU is concerned, but when it comes to a normal inpatient ward, the prone position will give better movement of the lung aspects, that we call it as lung structures or the pulmonary conditions, and patient can perform better when there is increasing the lung volume. Definitely change of position will definitely improve the breathing pattern of the patient. Once the breathing becomes easy, the patient can become functionally independent. I can put more limelight on the prone position because it is more of a technical aspects. Maybe if I talk more on that, many of you get bored because it's more of a medical terminology in terms of positioning is concerned, lobe is concerned, because positioning during the COVID patient is very dangerous because the infections may spread to different segments. So it is more of a medical terminology than explaining about oxygen exchange. Any questions? Any more questions? How do we prepare medical and allied healthcare students for post-COVID world? Very good question. Considering this proactively, different universities, they have already started online courses on what exactly the coronavirus is, what are we supposed to do as a common man, what you are supposed to do as a medical professionals, what you are supposed to do as a allied health professionals, what you are supposed to do as general practitioners. So everything has been listed by ICMR guidelines, or even in the Ministry of Healthcare, it is equally clearly defined in terms of roles and responsibilities. And even many of the universities like Rajiv Gandhi University of Health Sciences, they recently took an online training program for all the healthcare professionals. In maybe they all are needed in time of crisis to handle the COVID-19 patients. Many Indian nurses are going abroad and working because payment in our country is less. This one of the reason we are lacking of nurses. Sitting at this place, commenting on that may become contradictory. It is individual perspective, individual view. A healthcare profession, when it has to be looked at the social service than a business. I don't want to comment much on payment is concerned. Definitely, considerably, when it is looks to different nurse practitioners, they are practicing abroad, and in India, there is a huge amount of difference in terms of remuneration is concerned. Thank you so much. Thank you again. Stay home, stay safe, flatten the curve. Thank you.